We're now going to move on to a discussion around the Bachelor of Health Science from the School of Health Sciences. And we're very lucky to be joined by the Dean of the school, Professor Gregory Colt. Professor Gregory Colt is, as mentioned, is the Dean of Health Sciences and a Professor of Health Science and a Provost of our Vietnam campus as well. Professor Colt has an academic background that spans several disciplines, including psychology, psychotherapy, and education. He holds a PhD in psychology and is a registered psychologist and has worked extensively in academic research and practical settings in Australia and New Zealand. So I would like to hand over to Professor Colt to give us a brief introduction and welcome to Health Sciences. Thank you, Gregory.
Thank you very much for that, and a very warm welcome on behalf of the School of Health Sciences at Western Sydney University. I do want to say I'm very honoured and pleased to be taking part in this Vietnam Virtual Open Day, and it's great to see a number of people from Vietnam joining us here today as well. With a very strong partnership between UEH and Western Sydney University over many years, it's really exciting to now be able to extend our successes by offering a range of degree programs that are focused on health. Our two universities share many common values, and that is what makes it so rewarding for us to work together. Our purpose of contributing to community needs, our efforts to ensure a high quality education for all of our students, the applied focus we take in educating graduates who we know will go out and make a difference throughout their careers, and also the commitment that we both have to excellence. We're really excited about commencing two undergraduate programs in health commencing in 2023, next year. The Bachelor of Health Science in Public Health and the Bachelor of Health Science in Health Services Management. If we think back over the last 2 or 3 years, there are probably two critical things for me that the recent pandemic has taught us. First of all, we've all been exposed to the importance of public health and the role that public health practitioners play in ensuring the health and well-being of our population. 3 years ago, most members of the public would not have known what an epidemiologist was, would have not known anything about public health, but I think certainly it's come to the fore of people's minds. The second thing that the recent pandemic has taught us is that I think we've all come to really appreciate the importance of ensuring that our health services and our health service facilities can manage the crises like we've been experiencing. And in doing so, are led by strong health service managers. Shortly, you're going to hear from Dr. Katerina Tanus, who is our Director of Undergraduate Health Science Programs. And Dr. Tanus will tell us about our two degree programs that will be on offer from 2023 onwards. Personally, I look forward to being able to welcome many of you to these programs in 2023 and beyond, and hopefully also seeing many of you undertake at least part of your studies here in Australia with us in years to come as well. So Tim, I'll leave my comments there, and thank you very much and welcome again.
Thank you very much for taking the time to join us, Gregory, much appreciated. I'd now like to introduce our speaker for the Bachelor of Health Science, Kathy Tanus. Kathy is the Director for Undergraduate Health Science Programs. She has extensive experience in curriculum design and teaching practices in health professional education. She's also the University Academic Lead for Student Transition and Retention, and her research interests include focus on student experience, professional identity, ethics, and clinical reasoning. So I'd like to hand over to Kathy, and she will run us through some information about the health science program. Thank you, Kathy.
Thank you so much, Tim, and thank you, Gregory, for the introduction for the School of Health Sciences, and I guess an introduction to the importance of these roles in health. Thank you, Tim. If you could move to the next slide. Oh, that's me. Thank you. So I might go through each of the programs in particular first, and then go into some of the articulation arrangements that we have between Western Sydney University and UEH. So the first one, the Bachelor of Health Science, Health Services Management, is one major, and the second is Public Health. So they are two separate programs. Let's go through the first one, the Bachelor of Health Science, Health Services Management. So the Bachelor of Health Sciences program is made up of 24 subjects, 8 of which are subjects that are shared with other health courses in the university, in the school. And then there are 8 specific to health services management. These are focused on the daily operations of a health service, workforce management, finance, organisational structure, and analytics as well. The other remaining 8 subjects are electives, and this is the real benefit of the program that we have in the School of Health Science, in that the articulation means that you can gain credit for studies that you have already completed at UEH. So if you have a look at this map here on this slide, you can see that I believe I recall Yi Chen saying that most of you are in stage 1 of your current studies in UEH. So those studies that you are currently completing in your Bachelor of Business, you can use as credit toward a Bachelor of Health Science degree. And you can see that those subjects for credit are up here in the top row. So you can obtain 120 credit points. So you can get credit for 12 of your subjects completed at UEH, which is really fantastic. You would then progress into the Western Sydney University subjects, and these are listed here, and I won't go into detail too much today, but they focus on health determinants, they focus on culture and its impact on health, they focus on competencies as a health professional, they focus on communication skills, they focus on psychology and its impact on health. There is a subject here also on human development and disease, very important. There is also a subject on evidence and using evidence in health. There is a subject on transforming health, which is a project-based subject, and professional health placement, which is a 140-hour subject where students are placed in industry to work under the supervision of a health service manager. Now, I've missed some subjects in this set as well. Health administration and management is a specific, discipline-specific subject, a level 1 orientation to what is required to be a health administrator and a manager. Later on here, you can see that there is, apologies. You can see here that there is another subject called Health Services Management. This is a level 2 subject building on the first subject called Health Administration and Management. It has a 140-hour placement connected to it, and this is further exploration of the role and administration skills required in health services management. The final Health Services Management specific subject is called Healthcare Systems and Organisational Culture, and this is focused on human resources, workforce management type skills. You can see in total, the course will offer you 280 hours placement. This is industry-based placement. We find the places for students in industry. We make sure that students are well supported, supervised and mentored during their placement in the health sector. Okay, so this is just a very quick snapshot of the remaining 12 subjects that you will do at Western Sydney University. So a total of 240 credit points. On the left-hand side here, you can see that our program is accredited by the Australasian College of Health Services Management. And this is really important because it means that the program has been accredited for quality in terms of preparing students for the healthcare sector in health services management roles. The second program that we offer, the Bachelor of Health Science Public Health, is very similar to the one I've just explained for health services management. The difference is that there is less credit obtained through your studies at UEH. This is because it is a public health degree, whereas health services management program, because there is, I guess, overlap with your current studies in UEH in your business program, there is overlap in the business subjects. This is quite different because it's public health. And so there are more subjects that you will need to complete to be qualified in public health. So it means you can obtain up to 80 credit points if you complete this subject at UEH, plus any other 70 subjects. And then again, the series or sequence of subjects that you would complete at Western Sydney University. And you can see very similar overlap in some of the core health science subjects, a few differences here in that our public health students take on anatomy and physiology and health because they need to have a greater understanding of health diseases and their impact on the body. There is a first year subject focused specifically on public health and what it is and what public health work means in the health sector. There is additional focus on research and analytics, and there are two subjects in particular for our public health students. The first is biostatistics in health, and the second is epidemiology for public health. This is really important because public health, if you can think of the roles in public health around disease, monitoring of disease, that the basis of that is about data collection and analysis to observe trends and to assess the impact of interventions that may be occurring in health. Later subjects in public health, looking at specific public health project type work, public health in a changing world, and harm minimisation and prevention, focusing on more of a preventative and harm minimisation type role in public health, health policy and advocacy, looking more at strategy and policy as a way of promoting health. And again, in public health, we have a 140-hour placement in the health sector, organised under the supervision of a public health supervisor. The public health program is not accredited by any external body. It's not required in Australia, but certainly our design of this program is aligned with accepted public health sector competencies, and they come from our agency called the Council of Academic Public Health Institutions, Australasia. Just a little bit more about the majors. So these programs prepare you for work at the completion of the degree. So there's no requirement for you to do additional masters or anything like that. When you complete the health services management program or the public health program, you are ready to enter the health sector at beginning entry type roles. Okay, I've focused a little bit already about the placements, and the placements are really important because they give you exposure to the sector. They orientate you to the workplace, the sorts of other health professionals you might be working with, the sorts of demands that are placed on you as a health worker in those roles, and the systems that make your strategies work in health. So really, really important. And there's nothing more worthwhile than having that interface with real world experiences. This is what the work placements offer students, and students are always have wonderful feedback to give about their placements. The credit I've already spoken about, so it's quite generous. For the health services management articulation, you will receive credit for 12 subjects that you complete in your Bachelor of Business at UEH in stage 1 and 2 perhaps. And for public health, you would receive credit for 8 subjects. So 12 subjects is comparable to the degree to 1.5 years. So you're by completing your stage work or your stage study in the Bachelor of Business at UEH, you're contributing to half of the degree in health services management. That's what 12 subjects is. And for 8 subjects, it's 1/3 of the Bachelor of Health Science program. Just a little bit about the sorts of roles that you can enter into. So with health services management, you would be eligible for roles at level 1 type manager type role. These are the sorts of positions we have in Australia in health service management, medical centres. You could work as part of projects, management projects, public health manager. They are really entry level type management roles in the health sector. And this image here is of one of our students, Joanna, who is in one of those roles in the health sector, and her role is as a patient and carer experience officer. The health service manager role is really great for students who are very passionate about health and about helping people, but they do love organisations, they love administration and management. And so it aligns very nicely to students who have those preferences for work opportunities in the future. They don't necessarily work directly with patients or clients, but they arrange services, ensure that they meet the needs that have been identified through data. Some of the areas that graduates can work in is in private clinics, in medical centres, community health centres, nursing homes, aged care facilities, rehabilitation centres, hospitals, health departments. In preparation for today's information session, I did a little bit of a search on some of the health issues in Vietnam in particular, and some of them are quite similar to the health issues that we have in Australia: stroke, heart disease being some of the high ones, diabetes, but some of the ones that are quite unique to Vietnam are tuberculosis. In particular, tuberculosis has the highest burden of health in the world in Vietnam. So a lot of the strategies around that, there's a real significant need in Vietnam around managing the health needs of people with tuberculosis. This condition can be preventable through vaccination, which is a major public health initiative, which I'll talk about in a little while. But certainly health services management requires that systems are in place to outreach and make sure that those services are delivered in the most efficient and effective way. And so that this is a real need for Vietnam, tuberculosis in particular. Others are things like chronic obstructive pulmonary disease. This is a condition caused by air pollution, by smoking, again, quite a preventable type of disease, which, you know, again, will deserve and could be addressed quite well with a really good public health services management strategy. So just to identify some of the specific needs for Vietnam in the areas of health, where your role in health services management, and I'll talk about public health in a little while, may be able to significantly contribute to the health needs of the country. These are some of the roles that we have in Australia, and often I like to show these to students because why do we study? Well, most of us want to complete a degree that will give us a solid career and employment opportunity at the end. So these are the roles that we have in Australia for students that complete a health services management program. You can see that they're not all at level 1. Excuse me. For example, this one over here is at level 3, which which is a higher level and something that you could work toward. But just to give you an idea of the sorts of jobs that a degree in health services management can take you to. And at the bottom there, because I know you're students from Vietnam, and often international students will ask this, does this degree cater for jobs that are on the skilled occupation list in Australia? And they do. So definitely health services management graduates fulfill the roles in the skilled occupation list under those titles there. Obviously, we can't give visa advice and things like that, but that's what these opportunities link to. Public health, the sorts of roles that can contribute to a role in public health, in health policy development. You might have a role in population health analysis, reflecting back on the public health program, offers studies in biostatistics, epidemiology, They offer all the analysis and data that help guide public health strategy, the ways in which a country will address their health issues. You could move into the area of health, environmental health, healthy lifestyles, coordination, wellbeing officers, but certainly in public health, there is the arm that looks at treatment, but there is also the important arm of prevention, and preventative health program development is a really significant role for public health. Some of those conditions that I mentioned earlier in terms of the health or significant causes of death, for example, in Vietnam, stroke, heart disease, coronary obstructive pulmonary disease, those are all preventable diseases that can be addressed by really effective health services and public health strategy and service systems. These are the sorts of areas, again in Australia, just to give you an idea, in New South Wales Health, Department of Health, we have our local health districts in Australia, but certainly in Vietnam, you would have your Centre for Disease and Control and Prevention as a significant employer of people, graduates in public health, and also the Ministry of Health would employ public health graduates as well. Some of the roles that are advertised again in Australia, just to give you an idea of employment and where studies in public health may take you in the future. And again, in terms of the skilled occupation list, public health qualifications are listed there as well. Additional information, which may have already been covered earlier perhaps, but certainly at Western Sydney University, we really focus on the welfare of students. We focus on their success, and there are lots of supports available around assignment help, academic literacy help, ensuring that you understand the requirements of subjects and the assignments. There is also lots of assistance in the library around finding information. University work is very much about reading widely to show that you have understood what has already occurred in the area of health, not reinventing what's been done in the past, but moving on forward by acknowledging all the research in health. So that's important. Library searching skills helps with this. There's also lots of support at the university around supporting students' sense of belonging, making sure that you're not feeling isolated or lonely. There are lots of university events that support students together on campus and also online. There's also English conversation classes that are offered to facilitate confidence with English conversation, and Western Life is a social hub, the social network for students where they do lots of social activities so students can form really nice friendships. The other great thing about Western Sydney University is all of our programs have an academic program advisor. What this means is that there is an academic on the program who supports students, and they give advice around subject selection, changes in study pattern, if you're unwell, whatever impact there may be on your study, you have an academic person on the program that can support you with making the right choices. These are my details up the top there, and Dr. Nicole Peel is the academic program advisor for our Bachelor of Health Science. Thank you. Happy to take any questions.
Thank you, Kathy, for a very interesting and informative presentation. There is a couple of questions that have come through on the chat function, and Gregory's actually answered a couple of them already. So I just might read those for people who haven't seen those. So do we do placement as part of the program? And Gregory's responded, yes, placement is a very important part of the program, and students gain a great deal from that. The second question was, where do we normally go for placement, and is it in Australia or can it be in Vietnam? Gregory's indicated that that would be possible. They would anticipate placement opportunities in both countries. The third question, and Kathy, you might want to add to this one as well. It says, when COVID pandemic has passed, will there still be jobs available for students and graduates? Gregory's indicated that yes, both public health and health service management are rapidly growing fields in Australia and abroad. Did you have any other comments to that one? I'm sure that's a fairly common question.
Yeah, it is. And certainly when we look at health disorders, and there are the communicable diseases, such as the ones that are infectious, but there's also the non-communicable diseases. These are the ones I spoke about before: stroke, heart disease, cancer, all of those sorts of conditions. So public health works in those places as well, because there's a whole range of preventative strategies that can be put in place through strategy, but also there's also treatment options and looking at the data to measure the effectiveness of all the different treatments. So it's not just about COVID. Tuberculosis, the condition I spoke about earlier, is a communicable disease. It's spread. It's an infectious type disease that's been around for a very long time. And as I mentioned earlier, the health burden is greatest in the world in Vietnam. So it's not just limited to COVID, and there will always be jobs in health. They are roles that can't be replaced. You do need that human interface for this kind of work. And just our aging population, people are living longer, but unfortunately with more disease. So there'll always be a role for health services management and public health. I hope that's answered Tran's question there.
Yeah, thank you. And there is another question there as well. It says, is there any academic or English requirements to apply or for graduate for the course? I know that nursing needs IELTS 7.0 to be able to graduate.
I believe it's 6 or 6.5, but perhaps I can confirm that, Tim, and we can share that with the students at a later date. It's less than nursing, but not that. I believe it's 6.5 or 6. Maybe Yi Chen might know, but these are the requirements for the health science courses. Okay,
that's fine. We can come back on that one. And you mentioned that there is quite a lot of work placement as part of the program. Are the placements done in hospitals or other health organisations?
Both, yeah, both. So absolutely in the hospitals, in the local health districts. So those are both hospital and community settings, and private facilities as well. Wherever we feel that there's an opportunity where the students can achieve the learning outcomes of the placement under proper supervision, then we will place students.
And another question that's come through before our session was, does it matter if I don't have a background in this area of study to undertake the degree in either major?
Yeah, absolutely. So these are entry-level undergraduate programs, and so there is no requirement that you have undertaken any other study beforehand. So for the public health program, for example, the subject anatomy, physiology in health is a level 1 anatomy and physiology in health. Certainly if you did biology or something like that in secondary schooling or the equivalent in Vietnam, then that might be advantageous, but it's not necessary.
Okay. Thank you very much for that, Kathy. We're just about out of time. Do you have any final comments that you'd like to add before we finish up our discussion around health science?
No, not at all. Just thank you very much for the opportunity, and very happy to answer any questions at a later date if students have any inquiries.
Yeah, we'll actually, and that's a good point. We do have in the chat function a link there for any students who do have any questions that we didn't get a chance to answer or they think of later on. There is a form there that they can fill in, and we'll pass those questions on to Kathy and get the answers back to the students as well. So, all right, well, thank you very much, Kathy, for a wonderful presentation, and hopefully we've got some interest from the students in health science.